The FemiCushion is a new treatment method for patients who have suffered hard times until now. It can be used for all pelvic organ prolapse such as uterine prolapse, urethral, cystocele, rectocele, and enterocele. Rather than being confined within the body, the FemiCushion is used when the patient feels the need to do so or is in pain. It is a treatment method that does not impose a mental burden and is safe for the body. The FemiCushion is independently developed and is composed of the cushion, the holder, and the supporter. Furthermore, it is designed with consideration to replicate underwear so that it is undetectable from others. By using the FemiCushion, patients can be relieved of pain and bleeding. It will enable them to lead a normal life. Again, since it is not something that is placed inside the body, no burden is imposed on the vaginal mucus and organs. By keeping the organs within the vagina, it can also prevent symptoms from progressing. Remove the FemiCushion when sleeping. Wash repeatedly for sanitary use. Since the FemiCushion is effective in all types of pelvic organ prolapse, patients receive treatment at the same facility without having to change the hospital department. Those who are unsuitable for the ring pessary include patients who cannot apply it due to pain or bleeding, the ring pessary coming off easily for certain patients, patients that have to remove it due to sores, vaginal fistula, or granulation tissues. Those who do not wish to use the ring pessary include patients that do not want to put foreign objects into their body and patients who are bothered by the odor. Some patients have to remove the ring pessary for surgery. However, not all patients can undergo surgery due to chronic illnesses. Those who do not wish to undergo surgery include patients who does not feel the surgery is necessary because their life is not in danger, patients who wants to try other alternatives before deciding to undergo surgery, and patients who cannot undergo surgery due to financial reasons. Hospitals is another big deciding factor. For some patients, a hospital is not within a reasonable reach, the wait time is too long after a reservation is made, and some patients are too embarrassed to go to the hospital. Surgery can also cause difficulties in a married life. Hello, my name is Keiko Mitsui, and I am the inventor of the FemiCushion. The FemiCushion is a medical device developed to relieve patients who suffer from pain and bleeding from pelvic organ prolapse. This medical device enables patients to live a comfortable life. There are currently many patients using the FemiCushion. The FemiCushion is used the same way that patients would normally wear their underwear. Furthermore, it is a new and wearable treatment method that is gentle to the body and designed with consideration for privacy from others. Doctors highly rate it as a treatment method that improves discomfort, urination difficulty, and one that does not bear any burden on the organs or the vaginal mucus. In addition, we received great feedback from patients who regularly use the FemiCushion. They say the discomfort from the prolapse went away, I am now able to live at ease, and so on. We hope that FemiCushion can be widely used as a new treatment method for pelvic organ prolapse. Patients will first purchase a starter kit. There are 3 components within this kit, which includes the cushion, the holder, and the supporter. The cushion gently holds the organs within the body, making it the most important component. The surface is very soft and is made of 100% silicone rubber, which is said to be the safest for the body. The material within the cushion prevents organs from falling outside the body, and it holds it securely in place. There are 3 sizes: small, medium, and large. First, start with a size small cushion, then change sizes according to changes in patient's symptoms. The holder absorbs urine and discharge. Set the cushion onto the holder. Adjust the supporter to prevent the cushion from shifting out of place. The width of the supporter can be adjusted by the horizontal belt that is placed across the hip bone. Adjust the vertical belts accordingly to lift the FemiCushion. With our company's original cross-tension structure, the FemiCushion can be lifted entirely without applying abdominal pressure and is always in a fixed position. Everything needed is included in the starter kit. Patients will select the supporter according to their waist size. For size measurements, those with the average body type will measure their abdominal size above the hip bone. People with a more well-rounded body type measure at a spot where the FemiCushion will not fall when being pulled from below. How to wear. We recommend wearing it while lying down. Set the size small cushion in place with the holder. Distinguish the front and back of the holder for sanitary use. The side with the wider width is the front. Put this inside the pocket of the holder and do the same for the back side. This completes the setting of the cushion and the holder. Raise and spread both knees, then slip on the supporter. Pull the supporter up to the knees, then remove the surface tape on the inside of the crotch area. With one hand, slightly open the vagina, and with the other hand, set the holder in place. If lubrication is needed, use a few drops of market brand lubricant or baby oil, then wear the supporter. Stand up to fix the belts. Make the belts long enough beforehand, then adjust the length of the horizontal belt to the appropriate position so that it hangs on the hip bone. Use the horizontal belt as an anchor to adjust the vertical belts. When pulling the adjustment brackets down, the entire FemiCushion will rise up. The belt will not stretch even when stomach pressure is applied for firm support. This completes the fixing. The FemiCushion is easy to use, but there are 3 important points to remember when using it. One, only apply the FemiCushion when organs are back inside the body. Repositioning organs back inside the body is crucial. 2. Adjust the horizontal belt to hang onto the hip bone. 3. Adjust the vertical belts to properly lift the FemiCushion for firm support. If these 3 points are done properly, then the organs will be firmly kept within the body and the cushion will stay adhered to the vagina no matter how the patient moves. There is no need to wear the FemiCushion while sleeping, therefore remove during bedtime. The FemiCushion is being raised up by 4 different parts with the belt as the anchor. The belts cross each other under the crotch area to adhere the cushion to the vagina. The cushion may look big, but the cushion material inside molds to your body to hold it gently but firmly in place. There is no need to worry about the widening of the vaginal opening. Furthermore, when walking with the FemiCushion on, the Kegel muscles are strengthened, making the organs harder to prolapse. Over time, the size of the FemiCushion can be decreased. Using the bathroom. Remove the waist belt, then slide the supporter down like you would normally do with underwear. The cushion and holder will still be intact and attached to the supporter. After excretion, reposition the FemiCushion and wear as previously worn. If the organs prolapse during excretion, reposition the organs before wearing the FemiCushion. Many women may not want to touch the vagina, but repositioning is crucial for the treatment. Lift the organs with the fingers and push them back inside. After menopause, lubrication of the vagina may be needed. The FemiCushion can be used with market brand lubricant or baby oil. Lubricant can also be prescribed at the hospital. Rashes are easily caused by pelvic organ prolapse. In an occurrence of a rash, get prescribed for an ointment from a doctor. On average, it takes about 3 days to be comfortable with the product, so continued use of the FemiCushion is crucial. To train the Kegel muscles, apply the FemiCushion and walk, or tighten and tense the vagina and the anus. These are some commendations we received from patients. Even when stomach pressure is applied, the organs do not prolapse, so I can do anything without anxiety. About a month after using FemiCushion, the prolapse occurred less even while using the bathroom. By using the FemiCushion, nearly all those with difficulty urinating can be able to urinate smoothly. At a medical specialist meeting, some say the amount of urine in the bladder after urination was 0. FemiCushion care. Apply the surface fastener tape to the crotch of the supporter. Hand washing is recommended. However, if a laundry machine is being used, place supporter and holder in a laundry net. Set to gentle wash, then spin dry lightly. For the cushion, plug the hole underneath the cushion with the cleaning plug. Wash with soap, then rinse with lukewarm water. We recommend that those with urine leakage or a lot of discharge to wash it every time after using the bathroom. It will be convenient to have an extra cushion, holder, and supporter. Questions. What about when I ride a bicycle? If there is no sense of discomfort, then there should be no problem to ride the bicycle as it is. However, if there is discomfort, only take off the cushion, then place it back onto the holder after arriving to the destination. Can my mother with dementia use it? FemiCushion can be used under the supervision of a caretaker with proper understanding of the product. Commendations from users. I used to be afraid to do anything, but now I can do what I want with a sense of comfort. I even feel like losing weight, so I can now walk 2 hours every day. It was hard to use a vacuum cleaner or to cook in the kitchen, but now I can do all the house chores without any pain. Before I hated going out, but now I can hold heavy objects and I now look forward to going outside. I was sad that I could not take care of my grandchild as much as I was hoping to, but now I can carry my grandchild who is turning 1 as long as I want. I can carry objects no matter how heavy they may be without it prolapsing. I feel so much at ease. I was unable to tell anyone about my problems, which made my daily life depressing, but thanks to FemiCushion, I have no worries. Even when I used the bathroom, I could not urinate that much. I always felt that there was urine left and my body was bloated. After using the FemiCushion, I can use the bathroom easily and I no longer feel bloated. I was told that I have to undergo surgery again, but I do not want to do it so quickly, so I plan to use the FemiCushion for a year and then decide whether to undergo surgery or not. We hope that the FemiCushion can be widely used as a new treatment method for pelvic organ prolapse, and by using it, patients can live a bright and comfortable life.